Hi, I'm Dr. Matt B., and these are your emotional minutes. And today we're talking about weight loss surgery and the psychology of weight loss surgery. Now, you may know someone who's undergoing weight loss surgery or who has before, or you may have had the experience yourself, or you may even be considering it for yourself. Now, first of all, there's a couple of myths around weight loss surgery. A lot of times people will think about it as sort of like an easy way out, or that it's just a magic bullet. That, say, a patient who undergoes weight loss surgery was just doing it because they couldn't lose weight in other ways, or they were lazy, or they didn't want to change their habits, or something like that. And actually, interestingly enough, with weight loss surgery really requires a ton of habit change. It's really a difficult process and entails really sort of being ready to make those changes and a lot of education around sort of what foods to eat and sort of a really restricted kind of food regimen, and then also a regimen of getting a certain amount of exercise. And so why does psychology play in? Sometimes people say, well, I have to have a psych eval for weight loss surgery, and what the heck is this? Well, why are psychologists involved in this weight loss surgery process? And typically, people find that actually the psychological evaluation really isn't too bad. We just ask a lot of questions about your history, things like eating behaviors, mental health history, and really it's for the purpose of long term support, knowing people, knowing their history, knowing what sorts of things they've struggled with in the past to help lose weight, can actually help us understand how we can support people to make a lot of those changes that can be really difficult and can be very lasting. And so, at least from a behavioral or a psychological perspective, there's a few key things that we look at in terms of how people do after having bariatric surgery. The first concerns how people adjust to life emotionally. A lot of times people have the surgery and they'll be pretty happy with the results. They'll like the way it makes them feel, they'll like the health benefits it gives them. Other times people will have the surgery and it won't meet their expectations, and that can set them up to feel disappointed or even clinically depressed, or if depression is a thing they've experienced in the past, it might bring about an episode of depression again. And even in the instances where people are pretty happy with their results, sometimes life after surgery can just be kind of strange because there might be a lot of changes in terms of how you're viewing yourself as you look at yourself in the mirror if you've had surgery, how other people are viewing you, talking to you, treating you, out in public, or how family members are reacting to you, things like that. So that's kind of the first area we look at. And the second area concerns lifestyle change. Old habits really can die hard. It can be hard to change habits people have done for years or even decades. A lot of times patients after surgery find that that's not too much of a problem, at least in that they're working really hard to keep up with everything, all the new food regimens, all the walking and exercise. And the more and more they do it, the easier it gets because they just get more and more used to it and they sort of solidify it as the new routine. Other times patients do pretty well with what I just described, but there might be like one or two things that pop up. Say, for example, they are doing pretty well for the first couple of months, and then they drift back to old habits, maybe something like stress eating, or they start to develop new habits that they get really concerned will get in the way of their weight loss goals. And then other times people find that a lot of it's difficult and they need a lot of support. And then if people are experiencing difficulties, we can follow up with people after surgery and see how they're doing, see what sorts of things they might need for support. Maybe it's a couple extra appointments, consultation appointments to go over tools or strategies on how to get around whatever difficulty somebody might be experiencing, whether it's difficulties in how family members are treating them now that they have new habits, or maybe it's, if somebody does drift back to an old habit, how they might deal or cope with stress eating. And sometimes we might do that before surgery as well, and then after surgery if people find that they're having more difficulties. And some people might go through non-surgical weight loss programs that also incorporate psychology and counseling for very similar reasons as well. So hopefully that was helpful today, and if you are undergoing bariatric surgery, good luck with the process. And if you have any questions or comments, you can go ahead and put them in the comment box below. And go ahead and subscribe to the channel and turn on notifications so you can get updates. And again, I'm Dr. Matt B., and these are your emotional minutes, and we will see you next time.